your computer, it's best to use your phone and dial in. On your dashboard, a panel shows the dial-in number and passcode, so you'll hear better. At the end of the presentation, I'm going to help with reading some of the questions today, and Beak and Julia can follow up more about how we can get answers to the answer them to the best we can later on after the presentation for your questions. And a recording of this webinar will be posted on the DFSS YouTube channel. And if you just search Department of Family and Support Services YouTube, you'll find our channel, but we'll also tell you more later on the presentation about how you can access and get a copy of this presentation and recording. And with that, I'll turn it back to B.
Thank you, Tom. If you can go to slide 4. Created in 2009, DFSS provides a comprehensive, client-oriented human service delivery system that employs a holistic approach to improving the quality of life for our most vulnerable residents. DFSS supports services that enhances the lives of Chicago residents, particularly those most in need, from birth through their senior years. DFSS provides families with the resources they need to not only create a strong developmental and educational approach for the young, but across the lifespan. By coordinating services for vulnerable youth, adults, and elders through its various program divisions. Next slide. In 2016, DFSS launched a strategic framework with a mission dedicated to community, its residents, and families that seeks to improve the lives of all Chicagoans. Next slide. DFSS has contracted with agencies to carry out directly high-quality services to enroll children and their families. We're guided by these 3 priorities: maximizing access, reducing barriers to access, matching investments to community needs, improving the quality of our programs in order to meet children's needs, creating a system of supports, and reducing the administrative burden for our providers. Next slide. As I mentioned earlier, we serve vulnerable families in low-income communities and provide high-quality, developmentally appropriate services that wrap around the child and the family. In order to do this, we ensure a child's health and physical needs are met. We engage the parents and understand that in order to support them, we must recognize that they belong to families who live in communities. Chicago early learning sites are in these same communities and are funded by DFSS to operate programs like the federal Head Start program and the state-funded Preschool for All and Prevention Initiative programs. And now, Nicole Kraft will be describing the scope of the Dental Support Services RFP. Nicole.
Good morning and welcome. The Department of Family and Support Services administers Chicago early learning programs through a network of contracted direct service and support service delegate agencies. Currently, DFSS contracts with a network of 100 direct service delegate agencies across 351 sites. These programs may be delivered through center-based, licensed family child care homes, and home-based home visiting models, and may operate full or part year. Next slide, please. Under this request for proposal, The Department of Family and Support Services is seeking a support service delegate agency that can help the Children's Services Division and its delegate agencies and sites achieve the following priorities: strengthen its dental services systems, including relevant policies and procedures that ensure that dental-related program performance standards are met, both across its network of delegate agencies and sites and individual agencies and sites that fail to meet the Children's Services Division's dental-related monitoring performance measures. And develop innovative and effective practices for improving children's dental health at the grassroots level and improve dental health outcomes for low-income children and families. Next slide, please. DFSS intends to contract with one entity to provide services citywide that can meet the following required qualifications and conduct the following required activities: provide guidance on subject-related policies and procedures, policy and procedure development, and policy memorandum related to best practices, subject area research, and program requirements and standards. Consult with DFSS to provide clarity on program components and service expectations. Advise DFSS and its direct service delegate agencies on current and new dental health issues as they arise. Act as the co-chair of the Quarterly Health Services Advisory Committee and chair the Dental Health Services Subcommittee. Next slide, please. Support DFSS and its delegate agencies in forming citywide community partnerships with local dental providers so that agencies can refer children and families for services as needed. Next slide, please. Provide 4 to 8 annual trainings or workshops for direct service delegate agency staff. Topics may include dental program requirements, oral health education, Illinois state dental forms, the importance of oral health care for children, and others as defined by the department. Next slide, please. The contractor will also be required to provide intensive training and technical assistance to direct service delegate agencies that are identified by the Department of Family and Support Services to address deficiencies and non-compliances in dental health services as it relates to the policies and procedures that are required by the federal and state laws that govern the Chicago Early Learning Program. They will also set up or improve internal systems for meeting dental health related standards, addressing innovative practices, or addressing dental health issues that are prevalent in the community. Intensive training and technical assistance must include meeting with the delegate agency to assess their current systems and set improvement goals and objectives, working with the delegate agency to determine relevant action steps and appropriate timelines, providing training, coaching, and other resources to improve the quality of services provided, and providing follow-up training and technical assistance as necessary to ensure that an agency continues to meet the content area program standards. Next slide, please. The contractor must work with the delegate agency and partner site staff to develop and implement dental health services plans to ensure positive dental health outcomes for children and their families enrolled in the program. Next slide, please. The contractor will support parent education in dental health by developing and providing delegate agencies sample materials for parent bulletin boards and handouts that can be reproduced by the delegate agency, as well as training tips for parent orientation, parent education classes, and parent councils and committees. Conduct 2 to 4 1 to 2 hour sessions at the annual Chicago Early Learning Parent Conference. Conduct parent trainings in dental health related subjects at parent hubs. And these topics may include re-educating parents and guardians for 100% follow-up visits, assisting early childhood programs to remain compliant with the 45-day examination requirement, and any follow-up care for dental treatment post-examination. Next slide, please. The contractor will provide children and pregnant moms who do not have dental homes with pediatric or adult dental care, either directly or through subcontractors, by providing the following services. Oral dental examination conducted by a dentist within 45 days of a child's enrollment for children ages 12 months and older. Dental cleaning and fluoride for children ages 2 and older at least once a year. Restorative treatment and treatment follow-up for children and pregnant moms. Next slide, please. It is important to note that dental services must be accessible to children and families enrolled in the Chicago Early Learning Programs through easily accessible locations or mobile units that are state or city licensed and maintain necessary health and sanitation requirements. And finally, the support service provider will be reimbursed for direct dental services according to the standard Medicaid rates. The current rates are available on the Illinois Department of Health Care and Family Services website and are updated each January. Next slide, please. Now we'll discuss qualifications. The successful respondent must meet the following qualifications. Have at least one licensed pediatric doctor of dental surgery or pediatric doctor of dental medicine on staff who can serve as the primary consultant to DFSS and co-chair the Health Services Advisory Committee and its dental subcommittee. Identify a project manager to serve as the point of contact for all activities related to scheduling and coordination of services and activities. Demonstrate the staffing capacity and experience to conduct the services and activities required of this contract, including having 3 to 5 full-time employee staff dedicated to this project for providing training and technical assistance and other activities. Direct dental services must be conducted by credentialed and qualified dentists. Dental students will be prohibited from providing services. Next slide, please. The contractor must demonstrate expertise in children's dental health and dental development, community dental health and its impact on child development, social determinants of health, and how they impact children's dental health and development. Demonstrated working knowledge or capacity to acquire expertise in all of the following. Dental requirements for children ages birth to 5 who are enrolled in the Chicago Early Learning Programs, including the Head Start Program Performance Standards, the Chicago Early Learning Standards 2.0, the Illinois Early Learning Developmental Standards and Guidelines, and the DCFS licensing standards. Demonstrate the ability to interpret and explain dental policies that affect children ages birth to 5. Demonstrate familiarity and compliance with all HIPAA and Family Educational Rights and Privacy Act requirements. Demonstrate expertise providing training and technical assistance to adult learners on topics related to dental health services. Next slide, please. For a full understanding of the Chicago Early Learning Program standards as it relates to dental health, we've included a list of resources in this presentation, and this presentation will be made available to you at a later date. Next slide, please. Next, we'll discuss the performance measures. The dental health services contractor is required to develop and deliver training sessions and provide technical assistance and consultation in the area of dental health services to DFSS direct service agencies. Performance outcomes may be assessed in the following manners. After receiving intensive training and technical assistance from the support service contractor, the direct service delegate agency will demonstrate compliance with all federal and state guidelines which govern the Chicago Early Learning Program. The dental health support service contractor will administer pre and post training surveys that assess the impact of training on the attendee's knowledge. To monitor and recognize, next slide, please. To monitor and recognize intermediate progress toward these performance indicators, DFSS also intends to track output metrics that may include, but is not limited to, the number of trainings provided, the number of hours of intensive training and technical assistance provided, the number of community partnership collaborations supported including dental homes obtained by children enrolled in the Chicago Early Learning programs, the number of hours provided to the Health Services Advisory Committee and subcommittees, the number of parent trainings conducted, the number of delegate and partner agency site consultations conducted, and the number of children and pregnant mothers receiving direct dental services. In addition to these performance indicators and output metrics, DFSS encourages applicants to propose additional indicators and metrics, including those that demonstrate early success and are indicative to participants' progress. This concludes our overview of the performance measures. I'll now hand the presentation back to B. Nichols.
Thank you. And now we'll go over the selection criteria. Strength of proposed program. In the selection criteria section, under strength of proposed program, you will see applicants will be asked to respond to questions related to the required core elements, which are identified in the program description of the RFP. An effective program model for the right target population and desired results. Here, we may ask you to describe approaches to education, training, dental health issues, trends, and innovative strategies that you've employed. We will ask you to describe your agency's approach to providing intensive training and technical assistance to organizations that are failing to meet program requirements. Next slide. Under this selection criteria, program performance, outcomes, and quality. How the agency has performed in the past, and if the agency is committed to performance management and measuring outcomes over the last 12 months. If relevant, upload any report, studies, or documentation that demonstrates the results and accomplishments of your program. So here you'll be asked to describe any current and past relationships with other community dental partners. You may want to describe a particular collaboration that resulted in improved dental outcomes or access to dental care for children and families. Describe how at least this one partnership resulted in better outcomes for child and community health dental care. Refer to any performance reports or other documents which you have the ability to upload to further demonstrate your point. Next slide. Organizational capacity. Describe relevant staff positions and qualifications. Organizations monitoring of program expenditures and ensuring appropriate fiscal controls and records are in place. Policies and procedures, including hiring practices and the ability to fill essential positions in a timely manner. Next slide. Reasonable costs, budget, justification, and leverage of funds. The agency's financial capacity to operate the program, cash flow, and capacity to expend funds prior to reimbursement. Matching funds, including in-kind contributions that you use for this program. Program costs considered to be reasonable, given the nature of services provided and requirements for this program. Next slide. Deadlines. Applications are due on June 24, 2020 by noon. You will have to be registered in our system to submit. No emails or fax proposals will be accepted. And now I'll turn it over to my colleague, Julia. Julia?
Hi, this is Julia Talbot. I'm going to be talking to you about how to submit an actual application in the eProcurement environment, which is the environment, the computer platform that the City of Chicago uses to accept applications for funding for contracts such as these. Can we go to the next slide? Thank you. So what I'd like to talk about is, if you've never done business with the city, you will need to set up an account in eSupplier, and that as soon as possible. To set up an account, and there's a page with links in a couple of slides, and this is all going to be posted on the it will all be sent to you, and it's easy enough to find this stuff. But what you do first is you go and set up your account in iSupplier, which / eProcurement. There's kind of used interchangeably as soon as possible. To do this, you fill out about 4 screens with your basic business information, and you then send that application to the Department of Procurement electronically, and they will get back to you within basically within 24 hours to 3 or 4 days. And so that's why we tell people to start early. The whole theme with making an application in eProcurement and to the city, really for anything, but especially for our department, is start early and save often. So while say that you don't have your application or your eProcurement access set up yet, you will be able to review the RFP document by going to the eProcurement website on the City of Chicago. It's where you can see the RFP document, you can see what we're looking for, and you can review the questions, the application questions. I really suggest to people that they review the RFP document that we developed for you. It has a scope section that really discusses in a quite detailed manner what we are looking for, what we expect the application, the work to be, what you'd be applying for. After that scope document, you're going to see some evaluation and selection criteria. It will talk about how we make our evaluations, how we select candidates and move to contracting. And then after that, you should really review the application questions that we set up. So the scope document, from the scope document, we look and they're all, all of these things are linked together. They're not sort of random questions. So we look very closely at what our scope is, and then we develop selection criteria that reflects the values and the most important aspects of the scope document and sort of the qualifications we're looking for out of a contractor or an applicant. And then we develop application questions that kind of tie those two things together. And then when we go to when we go to review, we build our evaluation instruments off of a combination of the application questions and the selection and evaluation criteria. So it's all linked together. So that's why I really encourage people to read those narratives and scopes and to look at them critically. If you are looking at the application questions and trying to sort of develop an answer around that, we really want, you should be using the scope documents, that language and those ideas, those qualifications and specifications to build your answer and to make a critical assessment about how good a fit you are for this particular opportunity. So that's kind of my big overview on how to use the documents that we provide you and the information we provide you to make the strongest application possible. But then we're going to talk a little bit about the physical aspects of making an application, submitting an application in the eProcurement environment. First off, there's a 4,000 character limit, which includes punctuation and spaces in the application environment. In eProcurement, the applications are referred to as requirements, and the answers that you provide are called quote values. This is the terminology that they use. The system is used throughout the city for everything from Head Start dental services to tire, paving to tire purchases to playground equipment, everything. So the application questions are requirements. The responses that you provide us are quote values, and those responses are written into a text box that has that 4,000 character limit. The system will not count those characters for you, so we suggest that you write your application answer, the questions and the answers in a Word document and do the character limit counts that way. If you go over, it just cuts you off and we can't read the end of your sentence or the end of your thought. eProcurement was built on an Oracle platform, and it works best with the Internet Explorer browser, which is what Oracle apparently works best on. I have used this program, eProcurement, in Firefox and Chrome and Safari, and it works okay. But if you find that your computer, you're getting kicked out a lot, I suggest that you work it, open it in Internet Explorer. Don't use the other sort of pro tip I have is don't use the back button on your browser to scroll within pages in eProcurement. It will do it, but it will stop saving any information that you write. And then when you go to save, you'll get an error message, you'll get kicked out, and when you go back in, everything that you entered or tried to submit or wrote in past that time when you use the back browser button is not going to appear, and you're going to have to redo it all over again. Can we go to the next slide? So when we talk about eProcurement, we really talk about, like, one of the things about the eProcurement environment is that we're really not allowed to accept late applications. And if your application isn't in eProcurement, we can't build a contract off of it. And so that way, we really stress the need to submit to submit your applications by the deadline, which is June 24th, I believe. That's a typo, at 2020 at 12 noon, so it's June 24th. And we cannot accept late applications, we cannot accept email applications, we cannot accept faxed applications. You have to put an application into eProcurement and submit it successfully by that 12 noon deadline. I suggest that you avoid the rush and possible mishaps by submitting early. In this particular system, it is not an experience of you just hit submit and it's gone and everything's fine. You really have to go through 4 or 5 different screens. There's often error messages that the system will want you to correct. And so you really should give yourself 15 to 30 minutes. We really encourage people to try to get their stuff in the day before the deadline so that they have the time and space to make a good application, to have it be a less stressful, less frantic experience, because we really cannot accept late applications without re-releasing the entire RFP and making everybody who did get their application in on time to resubmit. And that does not happen easily or happily. And we really can't make any exceptions about submitting late applications under any circumstances without doing a complete reopening of the bid. So save often, submit early. I will say for people, not that anybody ever
Hi, everyone. This is Tom Mose talking. Julia is going to be calling back in because we can't hear her right now. So if you can bear with us for a minute so we can get her to call back in. Thank you for understanding. Hi, everyone. Again, this is Tom Mose. We're still paused waiting for Julia to call back in. So just bear with us another minute or two, and she'll get back up on the telephone so she can talk to everybody. Take you through the rest of the presentation. Thank you. Hi, Julia.
Hi, Tom. I guess I got cut off.
Yeah, thanks for coming back online. We're on the slide right now for technical assistance.
Oh, great. Well, I'm so happy that you guys have heard this particular presentation so many times that you probably could do it just as awesome as, do just a good a job as I can. I still can't see your screen, but I can follow along with my own.
Yeah.
So
yeah, you're on. Yes, you're real quick. You're on the technical assistance about questions and registration, and then the next slide. Good.
Thank you. So this is the question where this is the slide where we're going to talk about the different things that are available to you. So for questions on registration or for technical assistance, you can go to customer service at cityofchicago.org, or you can call them at 312-744-HELP. That line operates 9 to 5, Monday through Friday. As I have said on other webinars, you can also call me or email me, and I try to get back to everybody within 24 hours. I really try to be responsive to people, and so I don't promise that I'll answer the phone 24/7, but if you get back, if you leave me a message, if you email me, I really do try to get back to people within 24 hours, regardless of when that original email was sent, especially when it gets close to the deadline. I would say for more complicated questions that go beyond, that are talking about incompatibilities with your system or stuff like that, you probably are better off with the helpline. The people there have kind of a higher level of access into the system than I do, and so they might be able to resolve. But please do avail yourself of the supports that the city can offer to you in making these applications. And this is a complicated sort of system. It's not always very intuitive, in my opinion. And so it's really important that you start early and save your work frequently. So let's go to the next slide. We're going to talk about two different functions that that most people are going to encounter in the as part of their eProcurement application experience. One is how to accept amendment, and we'll do that first, and then the second is what the submission process looks like. And I like to walk people through that just so that they understand what a detailed process that is and why we really, really stress people giving themselves the proper amount of time to go through the submission. So let's move to the next slide, which is about, you'll see a screenshot about how to accept an amendment in the eProcurement environment. We generally do one amendment for each RFP that we release, if only to upload the webinar question and answers and the webinar document itself. So what I have on the screen if the RFP has been amended, in order to start an application, you're going to need to acknowledge and accept the amendment first in order to start your application. And then if the RFP has not been amended, you would just hit create quote from the drop-down menu in the actions box and click go. And that's going to take you to the application where you can get started. If you have not yet started your application and the RFP has been amended, the slides that you will see will be similar. You just, you know, you're going to have to accept and acknowledge that amendment regardless of where you are in the application process. If you've already started an application by accepting and acknowledging the amendment, that will grab all of the stuff, all the work you've already completed in the original application and pull it into the new amended RFP document in landscape. So let's go to the next slide. So to begin the acceptance and acknowledge process, you can open the RFP and view in view only, and you can see the RFP document. That's if you click on the highlighted, blue highlighted stuff circled and labeled 1. You can you're going to look on the so you either click on the blue, the number of the RFP, or you can click on that sort of that eyeglass icon, and that will both take you, to the RFP document. It will also, I think, take you to what is being amended. And every amendment, there's an amendment document that's going to be included as an attachment. And then there's a short little synopsis within eProcurement that sort of says, this amendment is to upload the frequently asked questions, or this amendment is to correct something. And those are very short and to the point, and hopefully, you know, helpful. So to kind of kick off the amendment, so what we have you do is we want you to look at these things. We want you to be familiar with how the document, how the RFP has been amended, and then you're going to start the acknowledgement process by clicking the Acknowledge Amendments button, you know, at the bottom right-hand screen of the screen, circled by the number 3. And by acknowledging the amendment, you are indicating that you are aware of the changes made in the RFP. Now, for the most part, we're going to talk about its frequently asked questions, but occasionally we find a mistake or that we correct as part of an amendment process. And what we meant, you know, by this acknowledgement process, we're really holding you responsible for that knowledge. So if we said, hey, like we said it was going to be red, but now it's going to be blue, and then you submit a whole bunch of stuff that's red because because the amendment, you didn't really read the amendment, that's gonna be on you, because we really want you to read the amendment. We want you to own it, and you're gonna now like wade through 5 screens of that to kind of, you know, bring that point home. So let's go to the next screen. So after you click that acknowledge button, you're gonna get to a screen where you accept that you have acknowledged the amendment. You are going to first check the tiny box that says that you accept the amendment, and then you are going to hit the box on the right-hand side, and you're going to hit the box on the right-hand side in acknowledgement, and that is going to bring you to the next slide. So let's go to the next slide, and at that point, you will be asked to confirm your acknowledgement of the amendment. So you are going to confirm by hitting yes, which will then take you to the next slide where you accept the terms and conditions. You'll accept the terms and conditions by checking this very small box on the bottom left-hand side, and then clicking on the accept button either on the top or bottom of the right-hand side of the screen. And that you have finally then accepted, acknowledged, and really accepted, come to terms with, embraced your amendment. Then at that point, you will be allowed to either continue working on your application or start your application. So the next slide, we're now going to talk about how to submit an application. So if we go to the next slide, please. When you are ready to submit, you're going to start by saving your draft one last time, because we all know that I really stress saving drafts. You save often, submit early. It's really my mantra. So you're going to hit the save draft function, and then you're going to hit continue. And at this point, eProcurement is going to do like a little scan of your entire application and let you know if it thinks you have some stuff missing. So if you're missing information, you're going to be given an error message. The error message is always in this like sort of small font on the upper right hand side. It says error, and then it will tell you what the error is, and it will give you some guidance on how to correct it. So I'm going to go through two error messages that people frequently see. One is you must quote on at least one line in the RFQ. If you go to the next slide, we have sort of a blow up of that. So in this example, the error message indicates that the lines found under the lines tab, which is next to this header tab, had not been filled out. So at which point you would go into the lines, you would go and fill out ones. We use the lines just as a heads up. It's a budgeting thing that really doesn't come into play until the time of contracting, but we need to have those lines filled out with number one, or really whatever number you want. We don't look at it for the evaluation, but just as sort of placeholder, so that when we move to contract, all of those lines are brought forward. If we go to the next slide, we have another example. And so this error is about an unanswered question in the application section. So remember, we talked about that requirements means application question, quote value means missing answer. In this case, and then it will say, okay, so a quote value is required for the requirement first name. So the requirement, and usually it will have, first name or something that really indicates kind of the content, or very directly what is missing. So in this case, in this example, you'll go to the requirements section. You'll look for the thing that says first name, or the thing that's associated with what the requirement name is, and then you'll fill out the missing answer in the quote value, and hit save and go on your merry way. So now going to the next slide. Once your application is free from errors, you're ready to proceed and submit. And so you're going to hit save. You're going to save your work. You're going to click continue, and that's going to throw you into the review and submit phase of the application. At which point you're going to save again. You're going to hit continue. You're going to hit. You can keep going forward to submission. So we're going to go to the next slide and see what happens, which is that you will have, basically the eProcurement is going to pull up a review sheet for you to check. So you're going to be able to check your attachments. You're going to be able to check all of your answers to make sure that they are the ones that you want to have. And then at the you'll scroll, the whole application is presented as a very long page that you scroll down. We'll go to the next slide to see what the bottom of this page looks like. And lo and behold, you will be asked to provide an electronic signature. So the pro tip on this is make sure you put in your name and title prior to checking the box. If you check the box first, like I would, because it's sort of the first thing, you get an error message, which is probably stressful at that point. And so put in your name, put in your title, check the box, and then you're going to go to the lower left-hand box, and you can kind of see it. I think it's on the next slide. I have a better picture of it, and you're going to hit submit. So if you look at that, the next slide, you're going to click submit. And at that point, we're going to go to the next slide, and you're going to see a confirmation that you have submitted. So eProcurement has a new function in that it will send you a confirmation email to the email associated with the address that you did this application with, and that will confirm that you have in fact submitted. This email seems to take about 24 hours to show up in your box. So if you really want submission, if you really want to know earlier, give me a call or drop me an email. I'm happy to look that information up for you. So that really concludes what I have to say about eProcurement. We're now going to open it up for questions of any sort. And thank you for your time. Tom or B, I'm gonna take it back to you.
Hi, thank you. This is Tom talking. I do not see any questions, so far. Let's see, we may have one that just came in. If not, let's see if I can get B back on the line. No, we didn't receive any questions. B, are you back on the line?
I am here. Yes.
And so right now there's, in this presentation, there's, I don't see any questions that are typed up into the panel on the right-hand side.
All right. And you know, this is a lot of information for you, and we realize that. Please take your time, look this over. We hope that everyone that's on this line applies. Here is our information, Julia, myself, and I can put you in touch with Nicole. If you have any questions after this webinar, you have my number, you have Julia's number, and our email addresses. We also, in Children's Services, have a central Dropbox. I'm not saying that you need to use that, but if that's the best mechanism for you, you must enter the RFQ number for this particular RFP, which is the Dental Services RFP. But reach out to us by phone or by email.
Hi, B. This is Tom.
Yes.
Just one question they asked about clarification about contracts. If you mind, I'll just quickly ask it. Would you please clarify if the contract fund is per year or per the 2-year contract?
All righty. You will find that on the bottom of page 12, anticipated term of contract and funding source. We'll be making one award, looking for one agency, and the contract will operate on a reimbursement basis. You see, the term of the contract is from December 1st, 2020 to November 30th, 2022. So with an additional 1-year contract at DFSS's permission. So I would encourage you to read page 12 to get more information about contracting, or you can give me a call or Julia. Was that it, Tom?
Yeah, that's all the questions we have. If there's any more questions that come in, those questions will be captured in this presentation, and B and Julia will be following up if there's any, as they talked about during the presentation. Thanks for that. Let's see. I guess the question the person's asking B is, she saw the term and read that section. However, her questions, they're asking if it still needs to be clarified, and if it's still not sure if they got it answered. But I see it, if you want, this is your program questions, and they can email you. Is that correct, B?
Yes, that's correct.
So
yeah, to answer her question or his question.
Okay, that's good to know. Well, this is the last slide. If you'd like to, I'll let you wrap it up right now, B.
All right, well, thank you so much for joining us today. And we look forward to receiving some really good proposals and awarding this. We're very, very excited about it. So thank you for joining us today. Thanks.
And thank you for everyone for joining us in this presentation. And remember, the recording will be made available on the Department of Family and Support Services YouTube channel. And reach out to B or Julia with any program or technical questions. All their information is also located in the RFP for their contact information. Thank you and have a good day, everyone.